Thank you, Nikisha. Well, it's not quite 5:40, and one of the things I pride myself on is starting on time. But being on time means being early, so I guess I can begin. I am Mary Bentley Lamarr, and I'm very happy to be part of the work group planning for this symposium. Professionally, I am the founder and executive director of the Sickle Cell Association of New Jersey, hence that connection earlier with Joanne, who's chimed in here. And maternal child health is also extremely important. As a matter of fact, my sorority passed a resolution, my region of Alpha Kappa Alpha passed a resolution to address maternal child health. And I've encouraged them to participate and support the mission that you have. That being said, we have a presentation today, and our presenters, I'm going to introduce them. And what they will be presenting on is Breastfeeding While Black, Engaging Community to Support and Uplift Maternal Infant Care During the Pandemic and Beyond. So let me tell you about these women who are doing amazing work. Tameka Jackson-Dyer, she is an international board certified lactation consultant who has a decade of experience working in WIC clinics, baby-friendly hospitals, OB clinics, and in the community. She began her career in lactation as a breastfeeding peer counselor with several Metro Detroit WIC agencies and earned certifications as a lactation educator, community health worker, and lactation specialist during her time there. She is a project consultant with Cofective and serves as the breastfeeding subject matter expert for Eastern Michigan University under the Centers for Disease Control and Prevention, Racial and Ethnic Approaches to Community Health, CDC-REACH, Healthy Asian American Project, HAAP. Tamika also acts as the lactation consultant for the HAAP partnership with Wayne County Healthy Communities, WCHC, under the National Association of County and City Health Officials building. REACH Community Breastfeeding Continuity of Care Project. In addition to her work with EMU, WCHC, and Cofective, this wife and mother of 3 is an IBCLCs continuing education content reviewer for Michigan Public Health Institute, chair of the Metro Detroit Wayne County Breastfeeding Coalition, volunteer mentor with Sister Friends Detroit, founding member of Southeast Michigan's IBCLCs of color, and owner of Crazy Milk Lady Lactation Support Services, LLC, providing prenatal education and postpartum breastfeeding assistance through home visits in the Metro Detroit area. That is Tameka Jackson-Dyer. Our other presenter, Dr. Sekeita Lewis-Johnson. She is a family nurse practitioner, board certified lactation consultant, and birth doula. The wife and mom of 3. She has always been passionate about delivering quality informed care to women and children. She is an avid advocate for equitable and just policies and practices, especially related to African American maternal child health disparities. She is a co-founder of Southeast Michigan's IBCLCs of color, immediate past president of Black Mothers Breastfeeding Association, member of Detroit Midwives, Metro Detroit Midwives of Color, and Power to Exhale Detroit chapter. That is Dr. Sekeita Lewis-Johnson. Their co-presenter is also Jennifer Day. She is an international board certified lactation consultant, founder and owner of Feed the Babies, LLC, an in-home and clinic-based skilled breastfeeding support service. Jennifer also serves as a Michigan Breastfeeding Network project manager. Additionally, she acts as chairperson of the Oakland County Breastfeeding Coalition and facilitator of a community-based breastfeeding support group entitled Meet Nurse Love in Oakland County, Michigan, and co-founder of the Southeast Michigan IBCLCs of color. The married mother of 2, happy, healthy, breastfed children, has committed herself towards decreasing disparity gaps in breastfeeding by educating the public using her voice and platforms, serving her community, and equipping and empowering future trailblazers to change the world. She is a leader, public speaker, consultant, clinician, advocate, and educator with thousands of experiential hours assisting and supporting the pregnant and lactating families she has, and continues to serve in clinical and in-home settings throughout Metro Detroit and Southern Ontario, Canada. And joining them, rounding out that team, is Shonte Terhune-Smith, an international board certified lactation consultant, postpartum doula, health and childbirth educator. She is also a wife and mother of 4 with over 7 years of personal breastfeeding experience. Over the past several years, she has worked diligently in Genesee County, Michigan, to increase breastfeeding rates, most especially in her hometown of Flint. She has provided lactation support in hospitals and at various pediatric and obstetrician clinics, promoting and educating women about breastfeeding. Shonte is also the owner of You Overcome Lactation Obstacles, YOLO, which empowers and provides culturally competent, evidence-based breastfeeding support services to Flint families. With skilled professional support as an IBCLC, Shonte helps mothers find solutions to ultimately reach their breastfeeding goals. She prides herself in caring, professional, efficient, and trustworthy care. Shonte has breastfed her 4 children and understands that there can be struggles with breastfeeding, the importance of support, and how rewarding it is to overcome the struggles. Normalizing breastfeeding is her passion. Ladies, let us hear from you.
Thank you so very much. As you read through all of that, the thought came to mind, I'm sure for many people in this call, wow, they're busy. But it is a blessing to serve in the community. And we take that as a really big responsibility and an honor to be able to serve the families in our communities. As this presentation goes forth, Breastfeeding While Black, engaging community to support and uplift maternal-infant care during the pandemic and beyond. We ask that you lean into the act of servitude. We see this as service and sisterhood and showing up as the experts in the community. Those that are co-founders with the Michigan Southeast Michigan IBCLCs of color, sorry, switching roles and hats, with SEMI, we really are steeped deeply in the community as birth doulas, as postpartum doulas, as childbirth educators, lactation consultants, DNPs, and just members of the community. We represent the community. We are born and bred of this community, and we take this work very, very seriously. So thank you for joining, and we are going to get started.
Okay, so Sekeita here. I'll just kind of brief over our objectives for today. We're hoping that at the end of this presentation, you will have a recognition of maternal-infant separation in a broader context. For example, due to like maternal illness or a NICU stay, or simply because of hospital policies, as we saw with COVID-19. Also, we're hoping you'll be able to identify ways systemic racism play a major role in disparate breastfeeding rates, and how institutional policies and social nuances perpetuate those disparities. And name 3 unintended consequences of COVID-19, pandemic for marginalized birthing and breastfeeding families, and to be able to identify ways to mobilize families, communities, and public-private institutions to create strategies, make decisions, and implement action steps that lead to equitable breastfeeding support in marginalized communities. So who are we? You got a snippet a little bit of who we are as individuals. We're going to talk about, I'm going to speak about our collective why. So established in 2018, we are a collective of Black international board certified lactation consultants. As you heard, we work in hospitals, community, and private settings. Our mission started off, we wanted to meet the unique needs of mentorship, fellowship, and professional growth of IBCLCs of the Southeast Michigan region, and with efforts to support our community with equitable access to culturally responsive lactation support and advocacy. So Jen said this, we are experts, knowledge-wise and clinically speaking, and we continue to provide in-home as well as telehealth services during this pandemic. So why are we doing this work? And we sat back and we thought about why we do this work together. And why did we decide that SIMI was necessary? The important bullet point that I have is that Black mamas and babies are dying disproportionately higher than anyone else. And this is not new. We're acting like it's new, but this is not new. Black mothers' self-reports of symptoms and pain are often overlooked and minimized, and therefore that leads to more mortality and morbidity. Institutional and structural racism. We've all worked in institutions where we see this carry out, even in our profession, and it's still carrying out. Obstetrics and gynecology, the knowledge was built at the expense of our enslaved ancestors. So all of that knowledge was built upon people who birthed us generations ago. We believe that anti-racist public health interventions are needed now. They need to be bold, they need to be concrete, they need to be operationalized, actionable. In saying that, you sit at many conferences and people will say racism is the cause, but yet the solutions are things like, you know, and implicit bias training is good. I mean, but that just creates self-awareness. That does nothing to break down the dismantle these structures that are in place. And we also do it for breast milk. Breast milk is healing. It's preventive health. And without further ado, I'll just keep going. Tamika.
We wanted to talk about what was happening here in the center of the pandemic when it first hit. Metro Detroit was hit really hard. We were right up there with New York and some of the other areas. And so in May, when we really started to operationalize a lot of our work, there were 47,552 total confirmed cases statewide. There had been over 4,500 total COVID-19 deaths, 414 daily confirmed cases, and 33 deaths every day. We are back up there now. Actually, we're hitting numbers even higher than this now, but back in May, this is what the numbers look like. Next slide. So the timeline, the first 2 confirmed cases happened here in Michigan on March 10th, and our governor declared a state of emergency. The next day, the WHO declared it a pandemic. The day after that, all the schools closed. The day after that, she banned all non-essential personnel from medical facilities, and there was a national emergency declared. When they started to ban non-essential personnel from the hospitals, that was when we started having problems with doulas being able to go to the hospital and accompany their patients. And there was some lobbying and advocacy that happened in the lactation and doula and birth field, where we got the governor to issue clarification on that order that said that doulas are actually considered part of the medical team and not a visitor. And so they were able to continue going with their clients into the hospital. We started getting cut hours for grocery stores. Price gouging started happening for water and cleaning supplies. And then on the 16th, they closed down the gyms, dine-in and restaurants, all the movie theaters, everything shut down. That was 2 days before my daughter's 18th birthday. So it was a lot happening during that time. The day after that, they started closing down all of the social services offices, Social Security, unemployment, online access or appointments only, which was a major issue here in Detroit, where many adults are functionally illiterate and or may not have access to online with a computer or Wi-Fi or things like that. They shut down the plants on March 18th. So we knew it was serious, because when the big three stops working here in Detroit, it's a problem. Okay. They started finally doing some more testing on March 19th. On the 20th, Jennifer wasn't able to go home anymore because they closed the border to Canada, and Mexico closed their borders to us. Next slide. The timeline continued. Hair shops and nail shops closed. And if you have ever been to Detroit, you know that was time of mourning for a lot of people. The hair and nail shops closed down. The stay-at-home order came out on the 23rd. Beaumont Health, one of the major hospital systems here, neared capacity as of the 24th. They started doing the load balancing plan for hospitals on the 26th. And that was when Governor Whitmer requested a federal major disaster declaration. Our chief of police tested positive on March 27th. The disaster declaration was approved on the 28th. We had over 4,600 confirmed cases and over 100 deaths at that time, and those were confirmed deaths. And I use that term because we know that the death rate was much higher. In some zip codes in Detroit, there was speculation that the death rate was actually 10 times higher than what was being reported. So for every person who came to the hospital, they were saying there was at least 10 people who were actually sick in that zip code. March 29th, we had 132 deaths. The prison cases doubled over the weekend. And then they opened up a field hospital. It continued, they started the pandemic unemployment. Our unemployment system computer crashed on March 31st. There were hundreds of thousands of people who were without any type of income because of all of the shutdowns for weeks. April 6th, over 17,000 confirmed cases and over 700 total confirmed deaths. May 10th, 47,138 confirmed cases and 4,551 total confirmed deaths. As of today, which was 2 days ago when we put this together, over 179,000 confirmed cases in the state with over 7,500 total confirmed deaths.
That's heavy. So as all of that was shared, as Sekeita shared, at our core, what we felt was the experience of families feeling displaced in a system where women continue having babies, people continue having babies, and babies continue to need food. Families equally not even having basic essentials and needs. And so the stress that was also there. And so literally in the moments, in the thick of it, we're clinicians, we're working in the field, we're getting calls, we're experiencing our family members, everything, stating that there was a crisis. We were feeling the crisis. Our experience of it, even with our own family members being testing positive, fatalities, everything. I know for myself, as of that timeline of what Tameka was just sharing, I had 12 family members who had died of COVID as early as then. So this was personal for each of us, even members of ours still working in the field, and us knowing that we had to show up in this space, but that we needed to be safe in doing so. And so one thing that was a really big issue that happened in the thick of it at the top was that women, infant, and children program doors closed at this time, where families here in Detroit and the Metro Detroit area go for breastfeeding support. The hospitals were not permitting some of the outpatient breastfeeding programs, services that they had, and the Women, Infant, and Children program were still providing services via telehealth or phone call, but not in person. And so this made it very challenging. We knew that we had to continue serving. And so we made really quick decisions to make sure that families still had our support. Next slide. So in the quickness, literally fingers going, we rallied together as a sisterhood and we're like, okay, we need to put out there that we are seeing families. And so graphics were made for social media and to share across the community that we could see families in person. We wanted it to be known across the community for providers to know everything, that babies continue to be born and families still need support with breastfeeding, and we can still see families in person because telehealth is not always the solution for dire crisis situations with breastfeeding challenges and issues. And so this is one graphic that was created amongst others to share externally that we were still supporting families. However, amidst all of it, we knew that there was more than just, okay, we're gonna go and we're gonna continue communicating and serving. We knew we had needs as well. And so amidst that, we made sure that we were protected with PPE, but there were costs associated to that. We are lactation consultants. We should be compensated to do these things. And so based upon that, we knew that it was important that we partner with others. So I'm gonna leave that up to Shonte to go into with more detail.
Okay, so we also, during the pandemic, you realize that it's limited physical support. So you have these moms who just had babies and you live in the middle of a crisis. There's no longer in-person support groups. So we decided to start our own virtual village. Every Saturday at 3 p.m. we host support group. We take turns and we rotate. We have families who either we've served and they come for continuous support, or moms that we haven't served and they just joined the group. We also have partnered up with our sisters in Battle Creek, Milk Like Mine, and their families also join our support groups, and they also join our virtual breastfeeding classes, which we hold every Friday at 7 p.m. Support groups usually last about an hour or so, depending on the conversation. And I look at it as more of like a sister friend group. We just don't talk about breastfeeding. We talk about other subjects. We talk about self-care, because mom is just as equally important as the baby. And we've had great reviews of moms feeling prepared for breastfeeding after taking our virtual classes. Next slide, please. And so as part of like that self-care and that mental health, because mental health is just as important as the physical and the breastfeeding, and we want mom to be overall well, we have therapists, counselors on our weekly support group calls. And we have Dr. Angela Dawson, who last support group that I was on, come to find out she has like this natural herbal store. Like, I mean, she educated us down the road. So that was awesome. We have Dr. Michelle Madison, and we also have Nafisa Johnson. And all three of these women share their expertise and their time with us for 30 minutes or so, and jump on and, you know, answer any questions that mom have. And it's a great asset to our support groups.
Just want to add that they are all Black moms who breastfed too.
Yes, because it takes a village. So what if virtual won't work? We were alluding to earlier the need for in-person services. We know that when meeting in person or making the decision between whether telehealth will suffice or whether it needs to be in person, twins or higher order multiples oftentimes need hands-on support. Doula clients, yes, there were scenarios where there was virtual telehealth situations for doula if a doula could not be in the hospital until policy changed with what Tameka shared earlier. Suspected TOTs or tether restrictions, tongue ties, things like that can significantly be identified early on in person versus via telehealth services. And then equipment being needed. Breast pumps. At the thick of it, we experienced families not having access to breast pumps because the buildings were all closed. And so having access to not just a breast pump, but also education as to how to use it. Making sure that the flange is fitting correctly, things that reduce the risk of later breastfeeding issues and challenges. And then lack of access of technology and internet and data. At the same time, children were still in school. And so because of that, you had multiple family members using high bandwidth technology and families just not having access to that. It was a gross assumption that all families had even a cell phone or a data plan to be able to do that, yet expecting them to have an hour-long telehealth appointment. So knowing that those are significant barriers and that in-person is something that could be used as a priority and a solution. And all of the photos that are in this entire presentation are all our real clients. These are us working in the field. And so you'll see that's myself working as a doula with a laboring mother, as well as Sekeita doing an in-person lactation consult with one of her clients. Next slide. All right, and so when in the work, you have to work your network, having relationships, partnerships, it takes a village. And as systems, as organizations, when we work together, then families have what it is that they need. And so we knew we could not do this alone. We knew that we needed resources. We shared that many of the buildings closed. That required families to have to purchase or go without many breastfeeding supplies or equipment. And so what we did is we partnered with the Michigan Breastfeeding Network. We partnered with the Michigan Department of Health and Human Services. And through all of this, in the middle of the pandemic, at its highest peak, we are so grateful. It almost moves us to tears every time we talk about this. So grateful by the groundswell of volunteers and contributors who donated so much, all the way down to knitting hats and making masks and everything for our families, for us. We were able to collect a total of over $60,000 worth of breastfeeding equipment, PPE supplies, and money for us to be compensated to do the work in the community. And so this is a graphic that was made, that was shared during the fundraising campaign. We called it the Invest in Detroit fundraising campaign. And it's a fact, breastfeeding saves lives, especially during emergencies. Over 80% of Michigan's COVID-19 cases were in Metro Detroit, and that these families needed our help. So we're just thankful for that fundraising campaign so that we could do the work. Next.
So we, when we came up with the idea of having a fundraiser, of course, it was, you know, why would they donate to us? We're just this little organization based in Detroit. We don't have, you know, a lot of connections, but we had a lot of relationships. And so we worked that network, and we found out what happens when people say yes. This picture here is from the delivery of all the equipment, which we were not expecting. I agreed to let my house be the depot for the drop-offs because I thought it would be a couple boxes of pumps. And the UPS guy showed up and just kept unloading boxes and kept unloading boxes. The whole truck was our stuff. And so we had loaner pumps, hospital grade pumps that we could use, personal pumps to give to clients. State of Michigan WIC actually donated those to us to make sure that moms could still get access to those things. Manual pumps, nipple cream. A friend is a seamstress, and she made our head wraps and matching mask sets so that we could still be cute when we went out in the field with our PPE. Because the N95s can be scary to toddlers, and so we had fashionable masks to go over it, and head covers that actually covered our hair, because the traditional ones didn't necessarily do that. And it was just the outpouring of support was absolutely amazing. We still have supplies left that we're still using now. And most importantly, well, not most importantly, but very importantly, the fact that we were able to be compensated, because in the beginning of everything, we were volunteering our time. Everything was pro bono. And like Jennifer said, we are professionals. We have worked hard. We have earned all of these letters. This is what we do for a living. And so to be able to be compensated adequately for the work that we were doing was very important.
Whew, yes. Okay. So I'm going to switch gears a little bit and discuss maternal infant separation from a different lens, a different frame. Take a look at the bottle. I want you to notice the date on the bottle and the time, but most importantly, to the right of it, you see, I love you. This bottle is a bottle from a mom who was separated from her infant at birth. Her baby in the hospital, and I'll talk about that separation in just a minute. Her baby had been exclusively breastfeeding and doing extremely well. However, due to some prior history, social work became involved, and then it was noted that baby would be placed in temporary foster care. I will say that we became involved after mom was told that she could not provide her milk to her baby while baby was in foster care. And needless to say, if you've been listening to Our Passion, you know that set off a catalyst of events. But it led to us working alongside CPS, social workers, and foster care, because we had to really educate about, first of all, the mom had not lost her rights. And secondly, it was critical that baby continue to have mom's milk. So our involvement was calling the top, whoever we called the manager of CPS at that time, who stated that they were unable to transport milk. They were unable to transport milk on such a short notice. However, I spent probably about an hour's time educating about the importance, educating about infant mortality, educating about this is an exclusively breastfed baby. You really want to send this baby home with a formula diet. After that, I said, okay, well, I have someone who can transport the milk. So we put out a filler. And again, Jennifer talked about leveraging relationships, and we were able, and the other part to that was baby was separated for over an hour away from mom. Talk about a barrier to even being able to get her milk to baby. So we use a community, and we started calling it the over the ground railroad. I mean, somebody would pick up the milk from some way, they would drop it off, and then the next person would take it to the next. And we took turns picking up and dropping off this milk. And I'm happy to report that after we did that for 2 weeks, mom and baby were reunited. However, the support that was required in this case when moms are separated from their babies. We know that there's also disparities there. According to Dorothy Roberts in her book, Shattered Bonds, 42% of all children in foster care are Black, even though Black children only make up about 17% of our nation's youth. And so we're always thinking every problem, we're solution oriented. Every problem that we've kind of come across, clinically speaking, we kind of say, okay, what are we doing about this? What are we doing? And so we developed that particular situation birthed this idea of Mama's Mobile Milk, which is a human milk delivery service for lower resourced mothers or parents who deliver and they are separated from their baby due to either the NICU, foster system, or child custody. The other thing that happened during COVID was there was the one parent rule for COVID. So what if only one parent drives? And what if the one parent has to go to work? And so again, we work in these cases and we're able to see, whoa, wait a minute, this is why this barrier is. There was a study that discussed how when babies go to the NICU, that Black and Latino women are less likely to continue providing milk beyond 1 month. So all of these reasons, we started to think about ways to show up, ways that we can help. And again, this was a volunteer coordinated effort. We launched September 14th. We also were able to partner with a university and say, hey, we need a virtual intern. And so we have a public health student who serves as our intern, that she is able to get her clinical hours virtually through being our volunteer, our intern for our coordinator position for. She trains, she's phenomenal. Angeline is her name. Angeline, I don't want to say her last name because I don't want nobody to come try to soup her up from us. But these are the things we've been able to also, we've had 2 calls with the state of Michigan, CPS, and after talking with Genesee County and Wayne County, we also will be training and showing up at a couple of their meetings coming up, I think next month or sometime. But this is the call, is that the work doesn't stop, the solutions doesn't stop. We don't need a random control trial to tell us what our community needs. We live it, we know it. And so when people say, well, where's the evidence behind that? Or how do you know this is gonna work? Because we're working in the system. We are the experts and we are Black women. And so I just wanna set that there, but we're going to keep this going. We are hoping to have Uber Eats for babies, and that was a coin that was something said by one of our other co-founder, Mia Rutherford, who we're trying to create an app that would act just like Uber, where the app you put in, you want your milk to be picked up and dropped off. And we also take proper precautions. Our volunteers, they use a touchless method, which means they go in, they do not handle the milk. The milk is placed in the cooler. It is closed. Once they get to the hospital, they open it up and the milk is taken out by staff. And all of that while wearing the proper PPE. So that's us in a nutshell, and how we continue to leverage our relationships with community birth workers, with Birth Detroit, with Metro Detroit Midwives of Color. And that's kind of what we do. We also are hoping, because we realize that in the Wayne County, language is an issue. So we're hoping to have a language line also for our Latino, our Arabic speaking, and our Bangla moms. So that's also something that's on our wish list.
Thank you so much. That's amazing, all the work that you have done, and just to be rewarded too in terms of the support from the community, that outpouring that was more than you imagined, and then to be compensated for the work that you do. I commend all of you, amazing.